today our other regional coordinators, Nicole Mahan with the Eastern region, Tiffany Eustace with the Northwest region, and Sarah Burkhead with the Central region. We are our team ready to help you wherever you may be in Virginia with tobacco control out there. So we're gonna do our what's the tea question. We want to just get an idea of what you know about the American Lung Association report cards. Did you even know that Virginia has an annual tobacco control report card? So you have 4 answers. Yes, I look for it every year to see if anything has improved. I've seen it before, but don't really know much about it. Well, maybe, or this is the first time I'm hearing about it. So mark how you know about the report card, or if you know. Couple more seconds. And then we will see how much everyone knows about our presentation topic today. Okay, so yes, 31% has seen it, and they see it every year, but the majority, 38%, you've seen it before, but you don't know much about it. And I think that's a good place to be, because today Thomas and Alex are here, and I think will give us a lot of information. And I see 24%, this is the first I'm hearing about it. So this should be a really great presentation for you if you're just learning about the tobacco report card, because it shows where Virginia is, but it also gives us where we need to improve on as well. So I would like to go ahead and keep us on time and introduce our speakers for today. We have Thomas Carr, who's the National Director of Policy at the American Lung Association since October of 2010. In this role, he directs state and local tobacco control policy efforts for the American Lung Association and is a primary author and editor of the Lung Association's annual State of Tobacco Control report. So he's the one that's doing this report and puts this report together. So he knows lots of information. He is actually one of the country's most knowledgeable experts on state tobacco control laws and policies. So we're so glad to have you with us, Thomas. And we also have Aleks Casper, and she serves as the Director of Advocacy for the American Lung Association, covering Virginia, Maryland, Delaware, and the District of Columbia. And she has been at the American Lung Association for the last 4 years. Prior to joining the American Lung Association, Aleks spent 15 years in a variety of roles, including overseeing government affairs in multiple states for the March of Dimes, which is focused on maternal child health. And you just saw the 4 areas that Aleks covers. So it's a wide area out there doing this great work. So thank you, Aleks, for joining us today. So Thomas and Aleks, I'm going to turn it over to you and you can start your presentation. Thank you again for joining us.
No, thank you for having us. We really appreciate it. And welcome, glad to be here. Again, Thomas Carr, National Director of Policy of the American Lung Association. Aleks, do you want to introduce yourself and share those and go ahead and share the slides too? All right. Oh, you're on mute.
Sorry about that. My name is Aleks Casper, and as Gina and Thomas mentioned, I'm the Director of Advocacy for the American Lung Association in Virginia. I cover a number of states. Thank you so much for having us today. Can everybody see the presentation, Thomas?
I can see it, so hopefully everybody else can.
Okay.
Yes, we're good.
Okay, great.
All right, great. All right, so we're here to, as Gina and others mentioned, we're here to talk about American Lung Association's annual State of Tobacco Control report, which evaluates states and the federal government on key tobacco control policies. As part of this presentation, we plan to do a broad overview of what the report is and the areas we grade on, and then get into more detail about Virginia's grades with some comparisons to some other states as well too. We'll also kind of cover broadly the methodology used in the report too. So let's go to the next slide. Wanted to briefly mention on some of the benefits of tobacco control policies generally, and it's one of the main reasons why we feel it important to evaluate states and the federal government in their State of Tobacco Control report each year. The point I would focus on in particular on this slide is that tobacco control policies can often protect hundreds of thousands or even millions of people at once. And a good example of this, and something we do grade on in the report, is smoke-free workplace laws, which once implemented in the state or community drastically reduce exposure to secondhand smoke in public places and workplaces. I'll also note the tobacco industry is hard at work and puts a lot of money behind making the use of tobacco products seem normal or even desirable. And one of the goals of tobacco control policies and tobacco control programs, and also the tobacco control community, should be to counteract this. Let's go. Okay. This is an image of the homepage for the State of Tobacco Control website this year, and the report is well available. It's available at www.lung.org/SOTC. That is kind of the vanity link for the report. The report is released annually, and the 2023 report was released several weeks ago on January 25th, 2023. There are a few pages unrelated to the grades on the website that may be of interest as well too that I wanted to flag. Is including a milestones page with key developments in tobacco control since the 1950s. There are top 10 lists that talk about diseases caused by smoking and secondhand smoke and tobacco industry marketing, among other topics as well too. And I think someone just put the link in the slide in the chat too. All right, just wanted to share a few of the main external goals of our State of Tobacco Control report on this slide. We do have internal goals of the report as well too, of course. The first goal, though, is super important to the Lung Association, as we want the report to be a catalyst for strong tobacco control policy change at all levels of government. The report generally draws significant media attention across the country too, and I think that's been true in Virginia in past years, in some past years too. So here are the 5 state tobacco control policies currently graded on in the Lung Association State of Tobacco Control report. Flavored tobacco products is the newest state grade in the report, having been added to the report in State of Tobacco Control 2021, so that was 3 years ago or so. We also grade the federal government in 5 different tobacco control policies in the State of Tobacco Control. I'll talk more about these grades in a little bit when I talk about the grades the federal government earned this year and kind of go into a little more detail about some things that changed from last year to this year. So this is the 21st year the Lung Association has released its State of Tobacco Control report, which is hard for me to believe, as I've been doing these reports, the majority of them. And we did celebrate our 20th anniversary last year and kind of reflected on the 20 years we had before we had the report and what had changed over those 20 years. So it's evolved over the years in terms of the state and federal policies agreed on in the report and the scope of those policies as well too. So in State of Tobacco Control, each state and the federal government receives a letter grade A through F in each of the areas graded on. Grades are benchmarked against best in the nation tobacco control policies or recommendations from federal agencies such as CDC's best practices for comprehensive tobacco control programs, which I know some people on this call may be familiar with. We publish the complete state and federal methodology for the report on the website, and it is included in the full PDF version of the report as well too. And that can be found on the For the Media page on the website, the PDF version of the report anyway. I'll talk through the methodology more for each state grade later on as well. So here are the grades for the federal government received in the 2023 State of Tobacco Control report. I thought I'd just start with the federal grades to talk about these first, and then we'll dig in on the state grades. The main change in the federal government's grades this year was an increase in the grade for federal regulation of tobacco products from a D grade last year to a C grade this year. This was due to FDA issuing its proposed rules to end the sale of menthol cigarettes and flavored cigars in April of 2022. The I for incomplete grade for minimum age of sale for tobacco products, which I know we sometimes get questions on, is due to FDA not yet issuing rules to implement the federal Tobacco 21 law, which was supposed to be in place 6 months after passage of the law, and that passed in December of 2019. So they were well overdue at this point, and that's why we don't. They would likely otherwise get an A grade if they did implement those rules. So we just wanted to share our national call to action for the report this year, and I was asking President Biden to finalize those rules that were proposed in 2022 to end the sale of menthol cigarettes and flavored cigars. If you wanted to take action on it, the action alert is still available at lung.org/stop-menthol. You would be added to the Lung Association's e-advocacy list if you take action. So I want to disclose that, but I would also suggest not using state or local government email addresses if you did take action. And I know there are sometimes some restrictions around whether people can take action on these kind of things. So you know, consider your circumstances and whether you decide to do this or not. Next slide. So on the next two slides is the overall grade breakdown for the 5 state categories graded in the report. As you can see, many states still have a lot of work to do to reach the goals set in state of tobacco control. So once we show Virginia's grades, there's a lot of states that can certainly still need improvement. We did see some positive news on the tobacco prevention funding front this past year, with 8 states registering increases of $1 million, or in some cases, much more in funding. This caused 3 additional states, Delaware, Maine, and Oklahoma, to earn A's in this category in the report this year. And several other states get close to earning better grades, including your neighboring state, Maryland, which had a big increase in funding this year. We did see a little progress in the flavored tobacco product grades in state of tobacco control this year, with California and DC receiving much better grades due to implementation of flavored tobacco product laws, although there's still lots of room for improvement overall in this category. Access to cessation services grades, which we'll talk a bit more about what that is later, also saw increases in a number of states. So here are the best and worst graded states in the state of tobacco control report this year, as well as states we've recognized as most improved. Unfortunately, Virginia is one of the states on the list receiving close to the worst state grades in the report, 4 Fs and 1 D, 4 F grades and 1 D grade. Alex and I will dig into why that is in a moment, but first it should be noted that no states receive straight A's in the report. So every state has some improvement to make in the tobacco control policy areas graded in the state of tobacco control. I'm going to turn it over to Alex for the next couple of slides, which are comparisons to neighboring states and kind of the best states, the best graded states in the state of tobacco control. Alex?
So as part of the report, we issue the report card, which is the grade, but on the other side we have an opportunity to really talk about what's important to Virginia and what steps Virginia can make to increase these grades and what best practices we should follow. It's also an opportunity to kind of summarize what's happened in the last year and what are those things that have happened and why we make these recommendations. And so for our state, we saw the state highlights, and for our state highlights, we've highlighted really 3 areas. Require tobacco product retailers to obtain a license. We know right now in Virginia that they're not required to have a license, so it makes it very hard on the enforcement side to make sure that our retailers are in fact following the laws. Repealing the tobacco surcharge. We'll talk about that a little bit later, but the tobacco surcharge allows health insurance carriers to charge people who use tobacco at a higher rate. And then increasing the cigarette tax by at least $1 per pack and create some parity or equalization among the products so that all the products are taxed in the same way. And I think we'll go through that a little bit later when we look at some of the other details. As a quick snapshot, we wanted to just look at Virginia versus the border states. I think you will notice that the most variation occurs in the smoke-free laws and the access to cessation grades. DC and Maryland grades have better than most states. I do cover those states as well. And we'll go into more detail in some of these a little bit later, but we wanted to kind of share this snapshot as a look, as a comparison. And then finally, we did want to look at Virginia versus the best states and see where those best grades are. I think, Virginia is far less off than we might look like in being able to earn a better grade and that access to cessation services. We'll talk about something that may help a little bit later on. And even with the, we want to point out that even the states with the best grades still have Fs in the tobacco prevention and control funding. So that is an area that we continue to see states have an opportunity to improve. Now I will turn it back over to Thomas and he can continue to go through, I think, some of the grades a little bit more individually.
Yes, thank you, Alex. I did see the question about vaping in the chat there, and I think I'll probably answer that now. Yeah, the in all our grades, well, in some of the, I'll try to indicate which grades include vaping in them, but off the top of my, so there are components. So tobacco prevention and cessation funding is just an overall grade, so they would include that. Is part of what we consider them part of tobacco products for that. Smoke-free air, we have an element that includes e-cigarettes. Tobacco taxes includes e-cigarette taxes, and then flavored tobacco products is yes, that also includes flavored e-cigarettes as well too. So, but well, let's go ahead. I figured that's something. Well, let's go back actually. Sorry, not done with this slide yet. Thank you. Oh, yeah, actually, never mind. Go to the next screen. Go to the next slide. There we go. All right. So the flavored tobacco product grade is a pretty simple one. It evaluates the extent a state has permitted the sale of flavored tobacco products, such as menthol cigarettes or flavored e-cigarettes. And so that's where e-cigarettes comes into the picture. Aside from the District of Columbia, which implemented its flavored tobacco product law this year, Virginia and all of its neighboring states do not have state laws or regulations on this subject, and earned F grades because of that. So it's there isn't, unfortunately, I think overall there's about 45. Yeah, I think I may have mentioned this earlier, about 45 states that do not have state laws or regulations on this topic. All right, let's go to the next slide, if you're able. So the tobacco taxes grade, this is based on how high a state cigarette tax is. It uses the cigarette tax average, which is $1.91 per pack currently, as the midpoint. It also looks at whether 5 taxes on 5 different types of tobacco products are equalized or set at the same level as the cigarette tax. And usually they're expressed in different. It's not per pack when it comes to other tobacco product taxes. It's usually like a percentage of wholesale price or a weight-based tax of some kind. And so that's but what it is, it's kind of equalized to the cigarette tax, or kind of the same level as it. I know that can be some people, it's tough to understand what that means. So I wanted to explain that a little bit. It's also better, and so the grade is also based on whether the tax is based on the weight of the product or not. And usually we disfavor weight-based taxes because they don't keep up with the industry price increases or inflation as well too. And really what drags Virginia's grade down in this category is the low cigarette tax at 60 cents per pack. That's what drags down their grade in this, their grade to an F in this. Several of the state's tobacco taxes are at an equal level to the current cigarette tax and not weight-based. So they do get some points there, but again, it really is the cigarette tax that that drags the grade down here. Next slide. So regarding the Tobacco Prevention and Control Program funding grade, I want to be clear, this is not a grade that measures what a state tobacco control program does with the money it receives, or reflects on the hard work the tobacco control program staff puts in to prevent and reduce tobacco use each and every day. That is certainly true in Virginia, where I know there's unique challenges from a major tobacco company being based there. But what the grade does measure, it measures how much the state legislature, or in some states, a foundation, appropriates or allocates how much money a state legislature, or in some states, a foundation appropriates or allocates to the state tobacco control program, plus funding from the Centers for the CDC's Office on Smoking and Health. And they provide a set amount of money each year to states. It uses the CDC best practices for comprehensive tobacco control programs recommended funding level as the benchmark or the denominator for the grade. And the grades run on a standard grade school scale of a slight curve. So after 50% of the CDC recommended level is reached, improved grades can be achieved in 10% increments up to 80%. And then 80% or higher of the CDC recommended level earns an A grade. And we do round up from like 0.5 below as well too. This chart compares some key data that goes into the tobacco control program funding grade to the states that border Virginia. The last column on the right is the key data point that determines the grade. As I mentioned before, Maryland did have a sizable increase in state tobacco control program funding this past year, and is the highest amongst the states that border Virginia in terms of the percentage of the CDC recommended level. So this is a similar chart that contains the same data as the previous one, but for the states that received the best grades in state of tobacco control this year. And as you can see, Maine is kind of way out in front on this, but as Alex mentioned before, what you also see in this grade is that they're Virginia is actually doing a little better than Massachusetts, which has a bad grade in this category, but has very good grades in pretty much all the other categories. So in the report. So this is the access. I'll just preface this by saying the access to cessation services grades is definitely the most complicated of all the grades. It's composed of 3 categories: Medicaid, state Medicaid coverage of tobacco cessation treatments and services, state employee health plan coverage, so state employee health plan coverage of tobacco cessation treatments and services, and then how much a state invests per smoker in the state quit line. Medicaid enrollees and the uninsured smoke at higher rates, and so we weight the categories. We weight the Medicaid part of the grade higher because of that. And then so the way it works is that Medicaid is the highest weighted category part of the grade, then investment per smoker in the state quit line, and then state employee health plan coverage. There are additional policies that states can implement that can cause them to either earn extra points or bonus points or lose points. Alex will talk about one of those that's kind of holding Virginia's grade down a little bit later, and a potential for it to be improved in that regard. Virginia had some good policies, but also some room for improvement as well. The Medicaid expansion, for example, that Virginia did several years ago, is really a big part of the grade, and so we're certainly glad to see that happen. The lack of consistent state employee health plan coverage, the level of investment per smoker in the state quit line, and the tobacco surcharge are things that weigh down Virginia's grade to some extent. So this is another chart, and I know it's kind of there's a lot here, so maybe we'll keep this up for just a little bit. But this chart compares the various elements that form Virginia's access to cessation services grade compared to the states with the best grades in the state of tobacco control this year. In general, the states with the best grades have better state employee health plan coverage, invest significantly more per smoker in the state quit line, and limit or prohibit the tobacco surcharge in the Affordable Care Act. As you can see, Virginia's Medicaid coverage is actually pretty consistent with some of the best states in the country. So that's certainly great news. All right, and this chart compares the various elements that form Virginia's access to cessation services grades compared to the states that border Virginia in the state of tobacco control this year. Let's see where we are. DC and Maryland invest significantly more dollars in the state quit line, which is largely responsible for the better grades there. And then Kentucky earns some bonus points for limiting the tobacco surcharge and mandating private insurance plans cover tobacco cessation treatments, as well as having no barriers for Medicaid coverage. And so that's why their grade is slightly better than Virginia's. Although, like we said before, the access to station services grade, once you get to a certain point, it really isn't super difficult to get better grades. So Virginia is actually right on the cusp of that. Let's go to the next slide. All right, so the smoke-free air grade measures the strength of a state's smoking restrictions in 8 or 9 categories, depending on if a state has state-regulated casinos or similar gaming establishments, and then 2 additional categories on penalties and enforcement. There are also penalties if a state has not included e-cigarettes in its law, and a state partially or totally preempts local communities from passing stronger laws. There are also bonus points that can be earned in several categories, and you can see some examples of those on the slide here. But if you prohibit smoking on restaurant patios of bars, for example, you get an extra point in the restaurants category as an example. So what hurts Virginia's grade the most in this category is the complete lack of smoking restrictions at all in state law, in private non-hospitality workplaces, and the limited smoking restrictions in other public places. This does include the allowance for smoking rooms in restaurants. And while I'm not sure bars technically exist as a legal entity in Virginia, if I remember right, what would commonly be thought of as bars also is the same deal there. This would also include smoking continuing to be allowed in the new casinos in Virginia, which I know there was some complaints about in the press recently. And I know personally, I was certainly glad to see those complaints. Unfortunately, the way they're probably likely to be addressed will not reduce the harm caused by secondhand smoke in the casinos. But Alex may be able to talk a little bit more about that in a bit. But not including e-cigarettes in the law that exist also cost Virginia a few points as well too. Then in terms of comparison to the states that border Virginia, DC and Maryland have comprehensive smoke-free laws that prohibit smoking in restaurants, bars, and in the case of Maryland, casinos, so they earn A grades. Tennessee's state law covers most public places and workplaces, only exempting small workplaces and over age 21 establishments. So that's where their C grade comes from. They also do have some preemption of local tobacco control law, local smoke-free laws. So that does drag their grade down a little bit more than it would. West Virginia gets a D grade in this category due to the percentage of population covered by comprehensive county smoke-free regulations. So it is not based on its statewide law, which is even weaker than Virginia's. But they do have about 59 to 60% of their population is covered by comprehensive local smoke-free regulations. So let's move on to, I think this is the, we're getting close to the end here. There's no question that the Lung Association's State of Tobacco Control report sets a high bar for states to meet. The report does that because the Lung Association believes that only strong tobacco control policies will put the country on the path to ending tobacco use in this country for good. We are also often asked why we don't issue one combined grade for states. And that is because all these policies, when implemented together, have an even greater impact. So we do not want weaknesses in some areas to get covered up by an overall grade. I'll now turn it over to Alex for the last couple of slides, which will focus on some things that happened this year and potentially some good things that happened this year in the Virginia legislature. So Alex.
Thanks, Thomas. So I just wanted to cover a couple of legislative issues that we and partners have been working on and talking about. I'll first go back and address something that's not on the slide. And I know that there has been some discussions we've been involved in, lots of partners have been involved around casinos and how we address smoking that occurs in casinos. So more to come on that. And I think there's an opportunity to be involved, which I'll share later on. So the two big things that have been our focus for this legislative session has been the repeal of the tobacco surcharge. As many on the call may know, it was actually passed last year to repeal the surcharge, and the governor vetoed it. And so we had some conversations, us and a number of partners had some conversations about why the surcharge actually hasn't been proven to work, and why in actuality it causes some people to actually forego care because they're paying a higher rate for that care. And so this year we've been pleased to support House Bill 1374 and Senate Bill 1011, which does repeal the surcharge and allows and kind of doesn't allow those carriers to be able to charge at the higher level. Both bills did pass the General Assembly and has been sent to the governor for consideration. Of note, those bills were both amended when they went through the process to include a yearly report to the governor and then chairs of House Commerce and Energy and Senate Commerce and Labor due every January to kind of show progress. And then the provision or the repeal expires January 1st, 2026 if nothing is done. And so I think, it will continue to be something that the Lung Association feels very strongly about, and will continue to have conversations around why we should be repealing it altogether and a permanent basis. The other bill that we were concerned with was House Bill 1417. And I think, Thomas can comment on this too. We are seeing a concerted effort by the premium cigar, the cigar industry, I should say, to look at lowering taxes on these products and kind of carving them out, so to speak, and capping the amount of tax that can be charged on them. And so we did see House Bill 1417 lowers the cigar tax from 20% of manufacturer sale price to 10% or 30 cents per cigar, whichever is cheaper. And so we and partners kind of advocated against this bill, and it did die when the General Assembly is adjourned, died in Senate Finance and Appropriations. I would bet we would see this bill again. I know that my colleagues across the country are dealing with this, and I actually dealt with a similar bill in another state. So for those of you who can be involved with our lobbying efforts, or just from an educational perspective, we need to continue to talk about the fact that, a cigar is in fact a tobacco product and does carry harms just like any other tobacco product. And finally, I will just offer up a couple of opportunities to be involved. There is a wonderful and strong coalition in Virginia, the Tobacco-Free Alliance of Virginia. We are always looking for members. We have lots of, we meet quarterly, and there are lots of kind of work groups around issues, including, places where we need to increase smoke-free, our policy committee, which deals with a lot of the legislative aspects of our work. And so there is the website there for you, and I think you're all going to get the slides, and I think they're probably also in the chat too. But when you go to the Tobacco-Free Alliance of Virginia website, there's a great section that says become a member. So we would encourage you to become a member and join us. And then, as Thomas mentioned, the American Lung Association Action Network, the link is there. I think it probably will be dropped in the chat as well. This is a really nice opportunity because it gives an opportunity to engage at the national level with a lot of things that we're doing at the federal level with not only tobacco related issues, but also our healthy air work and some other things. But it also adds you to the list so that when we send opportunities to take action out, for example, on bills that we engage in, they would come to you as a local Virginia resident and have an opportunity for you to reach out to your local lawmakers and voice your opinion. And so I'll leave you with those two slides. We hope to see you at either a TFAB meeting or see you come up on our Action Network list. And I think that wraps the piece for Thomas and I, and I'll turn it over to Nicole, who I think may have some questions for us. I will leave the presentation open and shared just in case anybody has a question about a specific slide. We could easily go back and address that slide. I'm thinking through the charts.
Yes, yeah, we should definitely I completely agree with that. So yes.
Perfect. Thank you so much, Thomas and Alex, for all the information. Again, if you guys have any questions, please feel free to submit that in the chat box or the Q&A. I can see both of them. But we did have some questions during registration. People submitted some. So I'll start with those first. And the first one was, what additional messages does the community need to hear to reduce tobacco use? We see the scary commercials already. So if you guys want to talk about maybe policy would be a good step, or whatever recommendations you guys have as well.
I'm trying to think. I mean, I think one, kind of tying it back to policy, certainly
Yeah.
more funding for tobacco prevention and cessation programs is certainly a way for there to be different messages that get out there. I know why maybe the scary commercials we're talking about is a tips campaign, and while that's certainly effective and it's definitely effective, and in that hard hitting media that we refer to, what it does do is it does encourage people to quit. But I mean, I think there can also be like inspirational messages about people who did quit and things like that as well too that can be useful too.
Definitely. And I think if you look really locally, if you think back to what you mentioned about the casino in Portsmouth, when that opened, there was a news article, and it was like, I remember one news article, and I'm based out of the Portsmouth Health Department, live in Virginia Beach, so I'm really close to that casino. And I remember when it first came out, everyone was so excited. And I remember there's a big portion of the article and even the video that interviewed people, and they were like, I quit for so many years. Like, why would I put myself, in this situation? And so there were so many people who stepped up and said something, and we were able to see that change, and it's not comprehensive, but I think it's good to see that people do have a voice locally, and they're able to influence, the community and those around you. Alex, do you have more to say about this?
Yeah, I just wanted to just add on to that too. I think to Thomas's point, I think, the scary messages are important and impactful. It's also those positive messages of people, sharing people, and just like you talked about, Nicole, those people who have quit, why they've quit, how they've quit, sharing the resources that are available. We saw the great slide that shows that we've got access to cessation services. So those services are available and the supports are in place. And so when people want to make that quit attempt, making it as easy as possible. And, I think the other piece, from policy perspective, I'll just mention, I know that it is a challenge. As we think long term, we know that there are policies in place that directly impact consumption. And, as we think about tax, and Thomas talked about Virginia's tax rate, we are 44th, I think, from the latest charts. And so we know that when you raise tax by, I think it's 10%, it reduces consumption by about 4% in an adult and 7% in youth. And so we know that that is a proven policy that does work. It may not be an immediate thing that we want to address or take on, but it is something I think that we should just continue to have conversations about.
And I'll just note I just wanted to add on the casino front too. There are actually efforts in other states where we're seeing casino workers who feel like they have enough power to stand up. And there's actually a casino worker run organization called Cease that is out of New Jersey. It was based out of New Jersey, but it's kind of gone nationwide as well too. That which is an organization of casino workers that are speaking up for their. And it was especially inspired by many casinos went smoke-free during the pandemic, and that was and unfortunately smoking has come back to many of those casinos now. So
yes, unfortunately saw that, and I remember just kind of old information that I thought was really interesting. There was a casino owner. It was my first conference when I started this position about 5 years ago, and I remember at the conference there was a speaker, Dan Brown, who I think is manager of a casino. And I mean, this was before COVID, and how he was really interested in turning his casino smoke free. And he kind of made it like a party, like a celebration. And so it was, I think, midnight when they were going to change it. And of course, they're open. And so he had like balloons, celebrations. And, he did say there was some kickback at the beginning, but afterwards, I remember him saying that there were people who traveled like 2 hours or something to go to his casino rather than another one closer to them because it was smoke free. And so it's great to see, the positivity and of course the health for the workers, and then people coming in. So I think it's great to, like Thomas said, it's great to hear those inspirational messages as well. Can definitely make an impact. All right, so the next question.
Just
Oh,
one
go
follow-up
ahead.
piece on the casino piece. There has been a piece that recently has come out that we could drop in the chat from the CDC that talks about, prohibiting indoor smoking in casinos is really the only way to curb secondhand smoke. So I know we've talked about, because I know we've talked about limiting it in certain places, but the piece that came out from the CDC, I think, talks specifically about eliminating smoking, and so we can get that link to you, Nicole, to drop in the chat too.
Perfect. That'd be great. Thank you. All right, I'm going to move to the next question. Sorry, I just think that's really interesting, so I wanted to add on more to that. All right, so back to the scoring. Which of the scoring measures have the most impact on the state scores? I know there are different kind of levels, and then I know Thomas said we don't do just one grade because I think it's important to look at the good and the bad. So are there certain measures that have a greater impact on the scores?
I'm trying to think. So in certain grades there's like weighting. So I think I mentioned that in the access to cessation services grade, some of the areas of the grade are weighted more than others, and kind of explained that in terms of Medicaid and there being more smokers in that Medicaid rollies, and there being a higher level of smoking in that population, unfortunately. Let's see this. So the smoke, let's see. There's also, I'm trying to think if there's weighting in other ones. Yeah, so in tobacco taxes, there's also some weighting in terms of the cigarette tax is weighted about 3/4, and then the other tobacco product taxes are weighted 1/4. So it's a kind of a points-based system. So, but other than that, I think I guess there is some weighting at the smoke-free grade, but all the categories are weighted the same. It's just there's some penalties and other things as well that kind of throw that weighting off a little bit sometimes. So.
Gotcha. Thank you for that.
Yep.
All right. And the next one we have is Virginia is ranked as an F overall. So what has other states done to increase their grade? How long did it take to see changes? So I guess an example would be, like you said, Maryland, have they increased their funding? Maybe other recommendations you have for Virginia? I know you've mentioned, and I'm sure there's many to talk about.
Yeah, I mean, so Maryland, before the increase, they actually increased their tobacco taxes by $1.75 per pack as well too. So that was the that's where some of that revenue came from. So I think that's probably worth mentioning. I mean, I won't sugarcoat it that it's going to be easy in Virginia, but that certainly, large increases in tobacco taxes, for cigarette tax, usually $1 per pack or more, are really effective. Some stronger smoke-free workplace laws, and that'll see an immediate improvement in the grade there. Flavored tobacco products, restricting or prohibiting their sale that also is an immediate improvement in the grade in that category as well too, and also proven to reduce tobacco use. So it's I think those are some examples. So, and hopefully during the presentation I shared some. I kind of answered that question too. So we answered that question.
I think there was a slide, and I think Alex is trying to pull it up. I see her screen pop up. Yeah, I know. And we'll share the slides as well with everyone in the recording. So in case you guys missed something, you'll be able to look back on that too. And real quick, Thomas, I know you mentioned earlier about taxes and weight, and weighted taxes is not recommended, right? Can you speak more on that? Because I've kind of heard about that, but didn't really understand.
Yeah.
Especially when it comes to like liquids with like vaping coming out.
Yeah. So what ends up happening is that so say you have like a 5 cent per milliliter tax, which is kind of what the industry usually proposes for e-cigarettes, and or certain types of e-cigarettes or e-liquid. what happens is, so unlike a Juul product that ends up being like 3.5 cents per Juul product. If you think about a Juul product has about, like one of the pods that goes into a Juul has about as much nicotine as a pack of cigarettes. So it's really disproportionately low, and it's not going to prevent anyone from using the product at all. So that's kind of why we don't support waste-based taxes, and we try to discourage it in the grading system that way. So and then it also doesn't keep up. So the industry will often increase their prices, or I know we had some pretty significant inflation over the past couple of years, so that also will increase the price too. So that's some of the reasons why we don't we kind of try to discourage weight-based taxes. So
Definitely, that makes sense. I don't see any more questions. I know Gary commented earlier about casinos, so it's definitely something we're working on. Definitely, hopefully, make it a healthier place for the workers, and also, people coming out to the casino as well. So, I guess I kind of wrap up. If you guys have any kind of takeaways that people can have from this webinar, the different topics or categories, I guess, of the report card, anything, we can work on that's realistic, I guess, in Virginia, like locally, tips and tricks, or, like you said, joining TFAV, we meet quarterly. There's a lot of great partners and coalitions and different organizations that we always try to work together. And I think everyone's always collaborative. And if you need something and someone knows someone else who can be a great help, I think we're really good at connecting people as well and making those connections. So again, do you have any huge takeaways from this?
So thank you for that plug. I'll plug the local involvement as well. I think TFAV, being involved in TFAV, signing up for our action network is important. I think when we see things like the cigar tax or the tobacco surcharge, the good or bad, I think having that network of people who are willing and able to take action and use their voice beyond just us as kind of organizations that are at the table, but having local Virginia residents and people who care about the Commonwealth is really important. And so I'll plug that. And I think that would probably be my takeaway. I think the state of tobacco control report, gives us the opportunity to pause. It gives us the opportunity to take a look at where we have the opportunity to grow, and what maybe some of those smaller steps are that we may be able to take to provide progress. Like Thomas said, I think we're really close on the access to cessation services of improving our grade. I think the tobacco surcharge will help, but I think there's places where we can take steps, and the report card also provides an opportunity, and Thomas can probably talk a little bit about this, but the piece that we may not see on the report card, or we didn't highlight on the report card, sorry, is this opportunity for thumbs up, right? And so if the state does something that makes good progress, but may not necessarily impact the grade. And I'm thinking about Maryland in particular, who increased their cessation or their tobacco control and prevention dollars significantly. We can recognize that. So, looking ahead, is there an opportunity to recognize some of the steps that Virginia is making moving forward?
I think, yeah, I mean, I'd like to respect share my admiration for all of you. I know it isn't an easy environment in Virginia, and I really appreciate the opportunity to be here, but also just all of the work you do. So, as kind of one takeaway, I think, it is certainly, we do grade hard, but we do think it's important for public health to have this come out every year, and as Alex said, to kind of serve as a benchmark for where things can be improved. So.
I had one quick question for both of you, and thank you so much. A great presentation. But you'd mentioned that this report card is a catalyst for change at all levels of government. Does the American Lung Association take this opportunity to meet with their senators and their representatives and really go over the report card in detail?
So we do share it with legislatures in some states, and also with the federal government sometimes as well too. I can't recall if we did that this year with the federal grades, but we certainly refer to them often. And as we saw in some of it, we have a lot of advocacy efforts we do at the federal level as well too. And as we saw, there was some improvement in our federal grades this year. So and we are seeing good things happen there in some cases as well too. Certainly the proposed rules on menthol cigarettes and flavored cigars are would be truly historic if they actually do come to pass. So we're certainly doing all we can to make that happen.
And from the local perspective, I use this report as well as the other signature reports that we use, because they are so full of good data and good policy content. I use it probably all the time with lawmakers, you know, for whatever the issue may be. I used it, for example, to talk about the cigar tax bill. So I do use it which kind of went in line with the release of the report. And so for us, I think in Virginia in particular, which doesn't always line up in some of the other states that I work in, the release of the report times very nicely with the Virginia session. And so we can talk about a lot of times whatever we're working on. So we were able to talk about the surcharge bills. We were able to talk about the cigar tax bill. Last year, we were able to talk about the tobacco retail license bill we were working on. And so I think it really lines up nicely there as well, to be able to kind of mesh up our media opportunity. And we do tend to get a lot of media in Virginia on this particular report. And so I think it's a nice tie-in, but I do use it pretty frequent with legislators as well. I share it with those that are our champions, and I share it with those who need a little bit of education. And I use it and reference it probably in a lot of our testimony and formal written comments that we submit.
Great, thank you, because it is really a great report to really work off of. You know, I think we all kind of realized and I hated it to show up like that, one of the worst graded states in a little list in your chart, but I know we kind of knew that, and it gives us the big picture, right? It gives us where we stand in each of these policy areas. And your comment, Thomas, at the beginning, these tobacco control policies, we know what works, right? We know exactly what works with tobacco control, and these policies can impact millions of people all at one time. So we have to continue working, you know, at the local level, at the state level, at the national level, to really push these policies. And that's why great presentation to really talk through each of those policy steps, where we stand and where we have, you know, ways to improve upon. And you know, we have a lot to improve upon. And I love the comparison of other states close to us too, because we know that we are a tobacco growing state. We have Altria right in our backyard, and some of these other states do as well. So again, thank you so much for your presentation today, for coming and sharing with us. It was a lot of great information for us. So as we wrap up, I would like to invite you to join us again next month. And next month, March 21st, we will have one of our own, Rita Miller, who is our tobacco treatment and nicotine dependence coordinator, come and talk with us about some services we have with Quit Now Virginia. Starting February the 1st, we had reimagined services, some improved services with their Quit line, and Rita is going to come next month and share those with us. So please come, please join us, please share this with your partners and colleagues. I think it will be a great presentation to hear how you can make that impact with cessation resources. That was one of the, you know, the columns there with the report card and how we provide cessation resources. And I believe we got a D on that, right? The D on cessation. So we are working, you know, a little bit up from an F. So Rita is the one to talk to all about that. So she will be here with us next month. So enjoy the last day of February as we look ahead to March, and hopefully this week I know will be warm, but if you're one of the team winter, we always have next week, right? For that 2 feet of snow to come. So thank you for joining us today. Have a wonderful one, and we look forward to seeing you in March. Bye.